Sway Health.
Hello, Colin Hung here for Sway Health, and I am in Boston, Massachusetts for the 2024 Patient Experience Symposium organized by ICD Events. This is my first time attending this event. I've always wanted to come, but this conference always conflicted with other events in the fall calendar. But this year, the stars aligned and I was able to be here in person. Today was day one of the conference, and Laura Cooley, who is the editor-in-chief of the Journal of Patient Experience, was the MC. She kicked things off bright and early this morning, and first up was a fantastically energizing presentation by Jeremy Segal. He's the System Chief Wellness Officer at NYC Health and Hospitals. On stage, he was joined by Kamal Lodaria, Senior Director of Care Experience, also from NYC Health and Hospitals. Together, they shared some very sobering statistics about the labor crunch. 40% of nurses and 24% of physicians plan to leave the industry within the next 2 years if we don't do something about it. And that was the message of Segal and Lodaria. We've got to work together to improve staff experience and staff engagement alongside patient experience. In their presentation, they shared a couple of tips and tricks that they have used at their organization. What followed was an excellent panel discussion moderated by none other than Dr. Zeev Neuwirth, and he's been on the show a few times. And what they spoke about was moving beyond the four walls of the hospital to enable good patient experiences wherever patients are. For me, though, the highlight of day one was the keynote session presented by Josh Robinson. He taught the audience how to drum in perfect unison. And he showed us firsthand how powerful music and rhythm can be to bring people together. It was a lot of fun to see how the audience was smiling and drumming to the beat. The message here is that if you listen carefully and work together, you can be in perfect unison. There were also some great breakout sessions here on day one. Susan Edgman-Levitin, who's the Executive Director of the John D. Stokel Center for Primary Care Innovation at Mass General Hospital, spoke about how their practices have invested in patient education. They found that the more they taught patients how to use and leverage the portal, the more satisfied they became with their care. It also helped doctors feel less frustrated, since patients were able to use those tools to better interact with them. Barbara Rabson, who is the President and CEO of the Massachusetts Health Quality Partners Organization, spoke at a breakout session about the very interesting work that they are doing on racial and ethnic disparities in patient experience. Using surveys and other data, they were able to show quite starkly how those populations are having very poor experiences with the health system. Julie Risch and Sasha Perez-Luer shared a lot of behind-the-scenes work that they have done at Advent Health in their breakout session. They spoke about how they're scaling their patient experience initiatives and bringing cohesion across a very complex health system. I was particularly impressed with their work on bringing consumer councils to that system at the system level in order to gain insights into the communities that they serve. Day one ended with a very good panel of payers. Yes, payers. And they spoke not only about improving their own member experience, but also how they want to work with healthcare providers to make the overall health experience more seamless. Daryl Weaver from Blue Cross Blue Shield had a great line. He said, although the relationships between payers and providers may sometimes be strained, that should not stop individuals who are passionate about improving patient experience from reaching out and working together with them to improve it. It has really been a great day one here at the Patient Experience Symposium. I'm looking forward to more good content tomorrow. As well, I hope to do a few sit-down interviews with people I met here on day one. This has been Colin Hung here in Boston, Massachusetts. Thanks for being here, and I'll catch you on the next video.